AudioJungle.
Warm welcome to another Doctor to You Health Mastery series. Doctor to You is an online medical consultation service that can assist you with a variety of medical conditions. But the purpose of these Health Mastery series is purely informational and educational, and it's to give you that confidence to approach your physician in the discussion of your medical condition with the comfort that you have, the level of understanding to ensure that you can engage and have a fruitful discussion that will result in an optimal management plan and an outcome for you. I do just have to state that what you'll hear about today is general advice and shouldn't be taken as management advice for your particular condition. If you've got anything that you'd like to discuss, please go and speak to your physician. We at Doctor will be delighted to hear from you in a private consultation and will assist you in the most optimal way possible. But whether that's us or your personal physician, do speak to them about your individual circumstances so you can get the management advice that's most suited for you. So I'm sure we all know what anxiety is, but let's go through how it's defined medically. Anxiety is an intense, disproportionate and uncontrollable worry or fear about something that's going to happen, and it's usually associated with various bodily symptoms that are as a result of a surge in the production of cortisol. Cortisol is your stress hormone, or adrenaline or noradrenaline. So these are your fight or flight hormones you may have heard about. Some of the bodily symptoms may include sweating or palpitations, so that's your heart beating fast, a feeling of dread, a feeling of impending doom, that something terrible is about to happen. There are various types of anxiety. So there's generalized anxiety disorder, and this is where one is anxious or has fear or worry in generalized circumstances. And you have specific phobias, for example, a phobia of spider. And some people have social phobias, and this is being anxious when they're in social engagements or meeting other people. And there is separation anxiety disorder. This is specifically in relation to children being separated from their parents and showing a disproportionate level of anxiety or worry for their level of development. You've also got something called agoraphobia. Agoraphobia is the fear of being in open spaces. There are many, many more other types of anxiety. We're also in the midst of the coronavirus pandemic, and some people may have generalized anxiety about developing COVID, or about a relative of theirs developing COVID because they have certain underlying conditions, or someone may have developed COVID and they worry about the long-term effects, or even developing it again in the future. So there's a lot of anxiety around coronavirus also at the present time. Now, everyone gets anxious from time to time, but clinical anxiety is when the levels of anxiety are to such an extent that it stops you from doing your daily activities. For example, it may stop you from going to the shops, if you have children, being able to drop your children off at school, being able to meet up with friends or family members, being able to even go into work because of your anxiety around various circumstances. When anxiety affects you to that degree, that's usually a time when it requires treatment and seeing your doctor to discuss various management options. Taken as a whole, studies have shown that anxiety can significantly reduce your quality of life as much as conditions such as asthma and diabetes. How common is anxiety disorder? Studies have shown that it's actually the most common psychiatric disorder. There is an average prevalence of about 7.3% in the population. It's slightly lower in people from sort of African, Caribbean backgrounds at about 5.3% or so, and just over 10% in people of a European background. What are the risk factors for developing anxiety? This is not an exhaustive list, but look, anyone can develop an anxiety disorder. It is, however, about 1.5 to 2.5 times more likely if you're a woman compared to a man. If you experience childhood problems, for example, maltreatment or abuse or parental problems, those can increase your risk of anxiety. If you've also got an underlying mental health disorder such as depression or a psychotic disorder, that can also increase your levels of anxiety. There are certain social stressors that can increase the levels of anxiety. We've got coronavirus, for example, at the moment, but also generally things like low levels of unemployment, work-related stress levels can also increase the level of anxiety. Other factors that are thought to increase your risk of developing clinical anxiety include being a victim of domestic violence, and that's true of whether you're a man or woman. But also, if you have a history of substance misuse or you have a chronic health condition, especially one that causes chronic pain, can significantly increase your risk of anxiety. Now, I touched on some of the symptoms of anxiety, but I want to go into them in a bit more detail. So I mentioned earlier, there is an intense, disproportionate, uncontrollable levels of fear, of worry, of terror, and this can actually develop rapidly to peak levels within minutes. And you also tend to have an associated sort of bodily symptoms of restlessness, terror, feeling sweaty, having palpitations. Some people might feel really tense, they might feel dread, impending doom, as if something terrible is going to happen. And as I mentioned earlier, these are all as a result of a surge in cortisol and noradrenaline and adrenaline, your fight or flight hormones. We also know that having anxiety can significantly increase your risk of major depression, and people with anxiety also have a higher level of suicide compared to the general population. Clinical anxiety can significantly impact on your daily functioning, and it's not to be taken lightly. It can, as I mentioned earlier, reduce your social engagement, reduce your productivity at work, reduce your engagement with family and friends. If you've got children, it may impact on your ability to take them to school. Now, what we do know is that if you have anxiety, your productivity at work can be reduced by as much as 10%. But if you also have anxiety with coexisting depression, your productivity at work can be reduced by up to 45%. That's quite a significant number. So what should you expect when you present to your doctor, especially the very first time? So your doctor will go through a series of questions inquiring about your thoughts, your feelings and your behaviour to ascertain whether you have an underlying anxiety, whether it's impacting on your daily activities, and how severe it is. Because we all can get anxious, and it's a continuum from very mild anxiety that doesn't impact on our daily functioning to moderate to severe anxiety that impacts on our daily functioning. So your doctor may also inquire about past medical history or family history of any mental health problems. And if relevant, they may also inquire about whether you had thoughts about suicide or self-harm, which can enable them to intervene appropriately. Sometimes your doctor may decide to do blood tests, because there are certain conditions that may mimic some of the symptoms of anxiety, for example, thyroid abnormalities. So it will be a whole series of questions to appropriately reach a diagnosis and exclude other conditions that may present in a similar way. So how is anxiety managed? Well, like with any condition really, having an agreed plan, so a plan that's centered around outcomes, clear outcomes that you'd like to achieve is really important. So we tend to call that a patient-centered approach. So with anxiety, first of all, it's really important for you to have a good level of understanding what anxiety is, have an awareness of some of the things that cause anxiety. So in general, we tend to worry or have fear when we think about things in the future that haven't yet happened, and we create a situation in our mind that's out of proportion, and that generates fear, dread and worry. So from a personal development point of view, sometimes trying to live in the present, and that's where things like sort of mindfulness or breathing exercises or meditation exercises can help with managing your anxiety. Now, there is an array of talking therapy measures that can be implemented, and across the whole of the NHS, it's very easily accessed now through a service called IAPT, so Improving Access to Psychological Therapy Service. So your doctor may actually give you their contact details for you to self-refer, because it's often really easy and for you to do and speak to a psychologist that way. They will go through various talking therapy measures, and depending on your severity of anxiety, they may start off with low intensity cognitive behavioral therapy, CBT therapies, which doesn't involve any particular monitoring by anyone. So you do the courses, the CBT courses yourself, and you self-monitor. And at times, you may have CBT therapy sessions that you again do by yourself, but they're monitored by a psychologist from a distance, and you may get feedback, and you can interact with them to see how you're getting on with it. Sometimes it may be necessary for you to have face-to-face therapy sessions, and these may either be group therapy sessions or one-to-one sessions with a psychologist. Additionally, having really good sleep hygiene and ensuring that you're getting quality sleep overnight is especially important to managing your anxiety. And this is something that your doctor will talk through with you on how you can improve your sleep. If you smoke or drink alcohol, you'll get some advice on reducing or stopping smoking altogether, reducing your alcohol intake. And if you have a history of substance abuse, you will also be advised on strategies on how to stop using substances, because these can all increase your levels of anxiety. Other factors that we key in managing, now you may have realized I've gone through a series of things and not mentioned medications. That's because there's so much more that can be done before medications. There is a role for medications, and it's a group of medications called SSRIs, selective serotonin reuptake inhibitors, or SNRIs, selective noradrenaline reuptake inhibitors, that are usually initiated. These can increase the response to management of your anxiety by up to 30 to 50%. So not everyone responds to them, but in 30 to 50% of people, you get a good response. It's worth bearing in mind that in the first couple of weeks of taking any of these medications, your risk of anxiety or agitation can actually increase, but this will usually pass. Okay, there is, in certain groups of people, especially in patients below the age of 30, you can have an increase in the risk of suicide in the first couple of weeks of taking the medication. There are times when it may be necessary to refer you to a specialist psychiatrist, and these are times where you may have moderate to severe anxiety disorders not responding to the various management steps that I've mentioned above, or when there's been incidences of self-harm or suicide, or when there may be other coexisting psychiatric illnesses. But your doctor will discuss this with you, and wherever possible, any referral to a psychiatrist would be with your consent. Another aspect that's really important in the management is having a good monitoring process in place. So your doctor may want to see you within the first 2 to 4 weeks initially to check on how you're getting on, but would also give you advice on how you can contact them should you experience any untoward side effects or symptoms. Again, depending on the severity of your anxiety, your doctor may discuss with you something called a crisis management plan. That's, should your anxiety level deteriorate to such an extent that you consider self-harming or suicide, to a point where you may become a danger to yourself, or sometimes even a danger to others. They will tell you what necessary actions to take in order to seek emergency advice, and that may require you to call NHS 111, contact 999, or if you can't get through to your doctor during working hours or because it's out of hours, sometimes even going to the accident and emergency or calling the Samaritan numbers, or depending on your locality, there may be local psychiatric emergency numbers that your doctor may give you to access as well. And having said that, your friends and family will be, useful resource and support around you where they're available and where you're happy to discuss your anxiety with them, so that they can also keep an eye for you and help you to seek that advice when it's necessary. So what are the long-term prognoses of someone with anxiety? If you have generalized anxiety disorder, this usually tends to be a chronic, fluctuating condition. So you have moments when you're not particularly limited by your anxiety, and you'll have other times in your life when you become limited by it. Now, the prognosis is not very good if there's a history of substance misuse or if you have other underlying mental health condition. The prognosis is usually quite good if you seek advice early, and especially if CBT, that's cognitive behavioral therapy, is started early. Now, it is worth stating that in about 40% of people with anxiety, you get a full recovery, and in about 50%, you get a partial recovery. So that's 90% of people get a recovery of some degree. So it's worth seeking advice early and getting the necessary help. Now, some things that I'd like you to take away from today are that seeking advice early is important, because as you can see, treatment that's initiated early, especially CBT, can significantly improve your outcome. But I also want you to do a lot of self-help. Okay, so trying to avoid, where possible, anxiety-inducing circumstances or situation can reduce your chances of developing anxiety in the future. So what do I mean by that? For example, if you're watching too much negative news, being around certain social groups, certain friends, maybe certain family members that speak a lot of negativity around you or about yourself, can increase your levels of anxiety. Sometimes you may need to change your work environment because of the excessive stress or the negative impact of colleagues that you work with. And on the other hand, reading self-help books, having a meditation practice, having sort of mindfulness, something that brings you more in the present than worrying about what's going to happen in the future, can help reduce your risk of developing anxiety in the future. But the key thing is, I'll emphasize again, whatever level of anxiety you think you might have, if it's bothering you and it's starting to affect your daily function and you're thinking about it too often, or friends or relatives have mentioned to you that you should perhaps consider seeking advice, embrace that word, go and seek medical advice and have a discussion with a professional, so you can be given an advice. You can be given an objective assessment and an advice that's right for you. Thank you so much for getting to the end of this video. I really appreciate the time that you're investing in improving your health. Now, if there was anything that stood out for you, or on the other hand wasn't so clear, please feel free to send us some comments. And if you're watching this on our YouTube channel, please put a comment below. This might just trigger something for someone else. Your insights may just be what helps someone else who is watching this. Now remember, these are generalized advice. If you want a sort of personalized medical advice, please see your doctor. Whoever that doctor is, we at Doctor will be more than happy to have a private consultation with you, and you can book an appointment by following the instructions using the contact details that you can see on the page. Now, I wish you good health, longevity, better years ahead, and success in your journey to becoming master of your health. Thank you very much.